August is Children's Eye Health and Safety Month. If your child is struggling to see the board in their new classroom this year, it might be time to have their eyes checked. Here to tell us more about the importance of those yearly eye exams is Dr. Adam Ham, optometrist with Hartford Health. It's great to have you with us, Dr. Ham. I think people would be surprised to know how early that a child should really get their eye exam. How early should they get it?
Well, actually, our recommendations actually between 6 to 12 months, which I know a lot of people don't realize. There's actually a program called the Infancy Program that is actually through a national program that whether you have insurance or not, every child 6 to 12 can actually have a free eye exam.
What does that all entail, though, for really a baby?
Well, it's obviously, we're doing more specific testing for, kids that age. Not going to put them in front of the mask, ask them which is better, one or two.
Exactly.
So, but there's very specific tests that we can do. We usually just have to report, to the program. That way, it's, keep getting funded, and that way we can take care of all the kids.
Okay.
That's great.
Very good. Now, I know in the yearly exams, kids get an eye screening, I guess is the way we need to phrase that. It's not really an eye exam. So what's the difference between the two, and how do you know when your child really needs that eye exam?
Well, the vision screenings, basically, the goal is just try to flag if a child doesn't have the best vision. Either both eyes can't see very well, or one eye is a little weaker than the other. So it's usually, they have them stand a certain distance away, read the chart, probably the paper one that's on the wall. Probably the same one that's been around for years.
Exactly.
But for an eye exam, we're going to do a bit more comprehensive work. So between, we'll have different methods to check vision. Not all kids, unfortunately, know their letters maybe that well, so we got numbers, we got pictures, lots of stuff. We'll check to see how well the eyes work together, if they can see their colors well, do their good depth perception, and also do a dilated exam so we can look in the back just to make sure all these structures of
the eyes are dilated for that.
Exactly. Yep. We like to get an initial one. So absolutely.
Okay. And technology to do that, what does that all entail?
Well, between we have either special cameras that can take images in the back of people's eyes. We have handheld, we call autorefractors, where not every child may sit there at the machine. So different methods that we can use to use for whether the best cooperative kid or the least cooperative kid.
Well, now is the time to do it if you can before school starts. Obviously, school has started for many schools now, but you do recommend having it done before school starts.
Yeah, I know a lot of times it's very common for parents to get their kids in for their yearly exam, just their physical, and they'll get their vision screening then, but that way they want to get everything set up for school. Once they get, we can get them in, get them seen, they can make sure their vision is going to be doing well before they start school. Especially, it's a year, another year in, more demand for reading, more schoolwork they'll have to do. We want to make sure that they're seeing well.
All right, what are the symptoms that parents need to be looking out for when, if they think something is wrong with their child's vision?
Well, the classic stuff, squinting either one eye, both eyes, rubbing the eyes, complaining of headaches, either on the front or on the back of the head. Sometimes they'll tilt one head to the side. And, I mean, some kids will just complain, they just can't see stuff,
Right.
So anytime you think it doesn't seem like your child is either doing well in school, or if you're, concerned that, I want to make sure that they're in good shape, yeah, absolutely, great to get a comprehensive exam before school.
And along with getting that child in front of the classroom instead of sitting in the back of the classroom, there are glasses or contacts that they can actually also get to correct their eye vision.
Exactly. Yep. Obviously, there's a lot of back-to-school specials that places will do too, so it's not a bad time, to any way you look at it.
And there are all kinds of looks out there that can appeal to every child of all ages.
Absolutely, yeah. There's a lot of cool colors that they have now, different shapes, different sizes. There's a whole lot more stuff available than, even 10, 15 years ago. So.
Makes it more fun to wear glasses these days, I think.
Yeah, honestly, I find I get more disappointed kids when they don't need glasses. So they'll leave crying because they don't need glasses, as opposed to the ones that, they get sad because they do need them. So, yeah, it's turned into a fashion thing.
Yeah, absolutely. Yep. Dr. Ham, thanks so much for all the advice.
Thank you very much for having me.
You're welcome.